My name is Zsolt Illes, and I am presenting this study which we conducted in the aquaporin 4 seropositive NMOSD population in Denmark, and we examined the mortality of this population. NMOSD, or Neuromyelitis optica spectrum disorder, is a severe disease of the central nervous system. It mainly affects the spinal cord, the optic nerve, and the brainstem. Therefore, the main symptoms are optic neuritis, myelitis, and certain typical brainstem symptoms like, for example, permanent hiccups. The disease is caused by an abnormal production of antibodies against the main water channel of the brain or the central nervous system, and that is the aquaporin 4 molecule. And if these antibodies passes the blood-brain barrier, then they will bind to the aquaporin 4 and the end feet of astrocytes, which is a kind of cell within the central nervous system. It will activate the complement system, and that's why these cells will be destroyed. This is the primary cause of the symptoms. So the patients who are typically affected are usually in the fifth or the fourth decade. But there is no other specific reason why a certain patients will be diseased. Sometimes it can be associated also with other inflammatory diseases or rheumatological diseases, even diseases of the nervous system, but this is rare. The typical course of the disease is a relapsing disease course. And usually it's an optic neuritis or a myelitis or a brainstem attack. They can be even combined, and it's very typical that the attacks are usually severe and disability can remain. So in this mortality study, first we identified the aquaporin 4 seropositive NMOSD patients in Denmark. Then we examined the mortality within this population, and we compared also to a matched general background population. We were also interested which are the patients who are on risk and also examined what are the differences between those patients who passed away and those who survived. So we conducted this study for several reasons. First of all, there are not many studies which examine mortality in aquaporin 4 seropositive NMOSD. Second, we wanted to know what are the predictors and what are the factors which pose risk for the patients. We also wanted to know how severe is the disease, and mortality can be one outcome which suggests this very nicely. And we also wanted to know what are the causes of mortality, because this can help us to reduce the mortality rate and also in a way prevent this severe outcome. In the study we found that about 23% of the NMOSD patients passed away during the follow-up period, which was about 8.5 years. When we compared the mortality rate to the mortality rate of the matched background population, we found that mortality was about 2.5 times higher in the NMOSD population. We found that the median age of death was 62 years, and that means that it was 19 years earlier what we found in the matched background population. Very importantly, we found that about 20% of the patients who passed away died within 6 months after the very first attack. All the patients who passed away had at least one transverse myelitis. When we compared the patients who survived or passed away, we found that misdiagnosis was 2.5 times higher among those patients who died. We also examined the survival rate in the aquaporin 4 seropositive NMOSD population. We found that the 5-year survival rate was about 90% and the 10-year survival rate was about 80%. That means that in 5 years, almost 10% of the examined population passed away, and in 10 years, about 20%. We examined the cause of death, and we found that in about 90% of the cases, it was related to an NMOSD. The most common causes of death were infection and also severe attacks, and we found that especially brainstem upper cervical spinal cord affection, or the combination of these and multifocal attacks were the main reason of mortality. We also found that about 40% of those who passed away died within 30 days after the onset of attack. Finally, we also examined the predictors of death. We found that age was a very important factor, and those who were older had higher risk to pass away. Also, more severe disease during the disease course or just before the death were predictors of mortality. We also found higher number of severe attacks among those who passed away. Finally, the number of relapses with poor recovery was also increased among the patients who died. The study is very important because, first of all, we see that NMOSD is really a very severe disease. We also see that this is utmost importance to prevent the relapses, because the severe relapses or relapses with poor recovery can be responsible for mortality. Finally, we also found that this is very important that every relapses should be treated, because we showed that even patients who had proper treatment for relapses could pass away. NMOSD cannot be left to be untreated. It's very important that every patient should be treated as fast as possible. We observed the mortality rate in a population which have been already treated in most cases with conventional immunosuppressants. Despite of this, we see the problem of increased mortality rate. And also we showed that despite of proper treatment of relapses, still patients can die. That's for the prevention of relapses is of utmost importance.